Hey,
What's up, party people?
we're here
of
for
Instagram.
another round, Doc Talks, and we get to speak about one of probably my least favorite pastimes.
We're going into my sordid past.
Yeah. So
As
we're
a
gonna go
retired
through.
runner.
Oh, what was it? What were we going through?
We're going through, you want to get into running, and you've probably done it a bazillion times, but you've gotten hurt every time. Docs, how do we stop doing this? Well, we got some answers for you because that's what we're going to talk about today.
Yep. So we got how to start running and not to get hurt. We have a couple of good points on here to talk about, to take some notes. We're going to start out with starting point being relative to the athlete that is going to be attempting this running cycle. So there's a couple of different areas that we can start thinking about for this starting point, and it has to be thought about in terms of whoever's in front of us is asking this question. Is it a very seasoned runner that got hurt and they're coming back, or is it someone that's never ran before and they're picking up a new hobby? That's very different starting points, and it's different for those people that kind of progress at a little bit different pace. So the first person that the first kind of context that we want to look at is the experience of that runner. I would say if they have a very high training age, or they've ran for a really long time, that's going to be someone that we might be a little bit more lenient with getting them back into a running program as long as the symptoms are being monitored. If they have zero running experience, meaning the only time that they've ran is when their big brother was chasing them with a BB gun or something, then we need to make sure that they go a little bit slower pace and they understand that this is going to be pretty slow and monotonous on the front end.
Were you chased with a BB gun as a kid?
Well, I mean, it came to my head for a reason. It was BB guns and bees. Those are the things that got me running. And
bees were terrifying.
Yeah.
I've never been stung. Fun fact. Yeah, I know, right? Because I'm terrified of bees. Yeah, so
you ran fast.
Yeah, that's why I got into running, exactly. But yeah, you're absolutely right. And then the reason why that is because someone who has ran for a long period of time, their body has developed adaptations to make them a good runner. There's a reason why, if you look at the elite level, all of them look very similar, right? They're very thin.
You can pick them out.
Yep, they don't have much muscle mass. They don't have much fat either. But also, if you looked internally, I don't recommend doing this because you'll go to jail, but if you were to look internally on them, you would also see adaptations that happen at their heart, at their different tissues in their body that make them good at what they do. Mm-hmm. Same thing with like a bodybuilder, right? There's a reason why bodybuilders are ripped, because they've done things to create those adaptations. So someone who runs a lot is going to have an easier time transitioning into running off of a layoff, as opposed to someone who doesn't have those adaptations, which could be yourself if you want to do a couch to 5K. So it's important that we don't put the same program on everyone just because they want to get into running.
Yeah, it's true. In addition to experience, so this person's coming from maybe a good experience, but all of a sudden they've put on a bunch of weight. Maybe during COVID they put on 30 pounds and their physical status isn't what they were before. We need to make sure that we're taking that into account. So physical status would be another thing that we need to account for someone getting back into a running or starting running. If they are very heavy set, if they're very thin, there's going to be two different routes or two different clinical thought processes of potential pain in the future for those people. Mm-hmm. So if we're looking at someone that does have extra weight, we're going to have a little bit more impact on joints. So we might need to very, very slowly take them through that process. So that might, again, take a little bit more time because we have to shed weight, or we have to figure out how to get those tissues to, like you said, adapt to being able to hold some of that stuff. We'll talk about the cadence and the frequencies and stuff that we can modify to make that happen, but it all has to be considered on the front end so that we don't get ourselves in a bad place right off the get-go. Because most of the time when we're trying to maybe do a running program, we have goals of, either changing our physical appearance. Most of the time, that's usually something that people start from. Well, maybe I'll start running to burn more calories, or they need a pastime that's going to kind of help them de-stress. So, we don't want to take that away from people as much as we possibly can if we want to keep them, steadily gaining more and more abilities to do that.
Yeah, for sure. And I would caution you, if you think that running is going to be the best way to get that runner's body, that's not always the case. Generally, the people who are very good at running are likely already genetically predisposed to looking that way. So if you're someone who just doesn't have that typical runner's build, don't expect to look like a runner. It's just like, me, I have more of a runner's build. I'm never going to look like Arnold Schwarzenegger as much as I try, right? And mostly because I don't have the nice hair that he had back in the day. But so point being, especially if you are that person who does have a little bit extra weight on you, and you want to use running as a modality for whatever reason, you may be better served in the beginning doing activities like maybe going to the gym and working out, or doing some cross-training activities with a little bit of running, just so you can prepare your body to tolerate those stressors better. Because you're right, Kyle. If you have a lot of weight, that's a lot of stress through the joints, and then you're doing X amount of steps over a given period. So it can be a problem for some people, and even some of the recommendations, we may have to slow those down even further.
Yeah, you can definitely practice the running. You can have bouts of practice, but it just can't be the only thing that you're doing maybe to get your body prepared. The more strength and more integrity that your body can withstand, a little bit more absorption, a little bit more control of forces that we can get. Again, taking into account physical status, and then into the opposite spectrum, if there's a very petite, small person that wants to get into this, and they haven't been in a running situation before, there can be other issues with that. There can be weaknesses, there can be imbalances. It could cause a lot of hormonal issues. There's a lot of stuff that can happen with that. So you definitely have to take into consideration physical status and experience. Those are two big ones for creating a starting point, and making sure it's relative to your goals or your status at that point.
Yeah, that's a great point.
And then making sure that we don't have these lofty aspirations that for a starting point, if you know that you have a goal of eventually running 10K, marathon, whatever it is, don't start as if you are training for that and it's coming up in 2 to 3 months. Be smart with the onset of your training. Get someone that's going to coach you through that, and they understand those progressions. A lot of times we get really ambitious, even if we're, an ex-athlete, and we can just transition into running. There's a lot of people that think, oh, well, I play basketball, so I can, get into a lot of running, or I can get into running after doing CrossFit for a couple of years. It's different stresses, and it's repetitive stresses, so the body definitely needs time to adapt.
Yeah, different sport, different demands. Just because you're good at playing the guitar doesn't mean you're going to be a rock star when it comes to the drums. So you got to make sure you take the time to prep, go slow, and you can get back into running with no problems.
Cool.
So let's talk about how do we do that next, now that we kind of have the foundation set. Let's say you're that person who has zero running experience, because I'm sure there's more of you tuning in than not. Run-walk programs are probably going to be your best bet, especially, you had mentioned some of our archetypes of someone who's very thin-framed versus someone who is not so thin-framed. This is a great starting point. So what that entails is you would walk for a set period of time, and then you would run for a set period of time, and then you can manipulate how much of each of those you do. In the beginning, you're going to start with a lot more walking with little bouts of running.
Practice,
yep.
Woo.
As you get more, it's going to be more running, less walking. And so, do you want to talk about what kind of amounts we would set?
Yeah, so we can start off with very, very low amounts, like you said, of running. If we want to go, I've had people up to 15, 20 seconds of running, just getting a regular kind of jog pace. And then they're off for the next, 2 minutes or something like that. That all can be very specific to the person, and especially if they're coming to us with a pain or they have been in pain. Maybe we start that jog, and then if we know that at 20 seconds we've hit maybe a knee pain that kind of starts creeping in, we're going to stop at 15 seconds, and then we're going to walk for the next 45 seconds to maybe 2 minutes, see if we bring that back down, and then introduce it again. It's a term that we call progressive overload. We start increasing these things incrementally, and then our body has a chance to adapt. It's not just overload, it's progressive overload. It's just trying to make sure that we're always pushing the envelope a little bit, but we're not getting to the point where we're creating tissue damage. So when we do like a walk-run program, we need to have check-ins, weekly, trying to get the understanding of how they did, and then they also have this understanding of they need to have a self-assess over the next couple of days. So assess how you felt after your training bout, right? I mean, that's typically what you would tell a patient. And we need to, not just during the running, we need to see if something else happens later on.
Yeah, because a lot of times you can feel great when you're doing the runs, because that's why people run a lot of times, because you get that runner's high, it feels good. Your body produces a lot of pain-relieving chemicals from the act of running. So you might not feel much during, and I mean, if you ask runners, they'll get this all the time, or we get this all the time. Man, Zach, I feel great when I'm in the run, but then I can't walk for 2 days after I'm done. So you have to assess, not just during, but immediately after. How are you doing that night? How are you doing the next couple days? And if you have a good response over, say, 3 days, then especially in the early stages, that could be an opportunity for you to progress and increase the amount of time you run.
Oh, yeah.
That's one option. So if you're going 15 seconds, go small. Maybe go like 17, 18 seconds for your next increase. Or if you're going 20 minutes, maybe 22, 23 minutes of the same protocol. That could be another way that you could progress the same thing. But just make sure that you're continuing to feel good as you do this. And if you get to a point where you're sore, you're hurting, that's probably not the time to bump up your volume or bump up your intensity.
Exactly, yeah. So even if you do follow the golden rule of increasing this stuff kind of slowly, you still have to listen to your body. If your body says you can't, and you're thinking you have to follow this golden rule, you still have to listen to your body. And if it says no, hold on, let's maybe go another week at this cadence, or bump it off a little bit and see if we can continue this progress. You need to listen to that, because it's your body telling you, hey, I needed a little bit of time to kind of catch up. We're going a little bit too fast. Golden rules, or rules in general, are guidelines, especially when we're dealing with human bodies, because there's so much variability that happens. So don't think that you have to do it just the same as Joe did, or Sally did, or Bob did it. Maybe they just have a different cadence that they can go at. It's very important to individualize yourself, especially in this sport. I mean, it can be pretty gruesome for injuries, just kind of being a repetitive sport.
Yeah, for
very,
sure.
very repetitive.
For sure. And this is especially true with specific areas that runners may oftentimes hurt. So it's one thing, if your quads are sore, your hamstrings are a little sore, you can probably keep going. But if you're getting shin splints, if you're getting soreness on tendons, whether this is your Achilles tendon or the tendon just below your kneecap, those are especially things that you do not want to push through. And it may be even a smart idea to take a day or two off, let that calm down so those tissues can adapt to the stressors you put on them, and then go ahead and resume things again.
Yeah, that's a huge point for all patient care, is knowing the difference between pain and soreness. We have to make sure that we understand those two differences, because there's a lot of times that patients will say, oh, well, I got kind of sore in certain areas, and then you got to let them know, soreness is okay because the body can adapt to that. Pain, if it's kind of repeatedly done over and over again, it can actually get worse. So most of the time with soreness, if we do it over and over again, it gets better. We have the same stress and less pain or less soreness. So use those for your progressive overload, run, walk variations, and then always checking yourself afterwards. Check yourself afterwards for your running to see how you do.
Lest you want to wreck yourself.
Lest you want to wreck thyself. Okay, so now you have made it to running. If you have done a run walk program and you're like, man, I feel like I can actually run for 10, 15 minutes, what's next? How do I start increasing that? We touched on it a little bit briefly, but you want to explain the 10% rule?
Yeah, so an intelligent progression, and this is a rule of thumb, one, but also two, it seems to have some research to support it. You should never, or when you do increase things, because inevitably you're probably going to want to run more than 15 minutes, you should do so at 10% increments over a week's time. And that can be mileage, that can be how fast you run, that could be the type of surface
Terrain,
you run on. That could be another thing we didn't even think about is elevation in terms of where you're running. So, it's very different running at sea level versus running up in the mountains.
Ah, that elevation. I was thinking okay, gotcha. That's a good one.
Yeah,
That's
so
really
those are all different stimuli. And when we say 10%, we're talking the entire week's amount. So let's say you're running a total of 20 miles in a week and you decide, you know what, I want to run a few more miles. What's a reasonable amount to increase? Well, 10% of 20 would be 2.
Cool.
Yes, 2. So your next week you might run 22 miles. Assess, doing the same things that we talked about before, see how you feel. If that's good, you could probably bump up another 10%.
Yeah. I've had questions over over some cases. How do you measure like intensity or elevation or something like that? If you have a distance that you're running and we want to look at increasing maybe elevation, then you'd look at the total amount that you gained during that run, and then you'd add 10%. So that's a good way to start measuring elevation intensity increases. So if you have to look at your Strava, look at something that you're seeing how much elevation gain you have during that, and use that as a 10% rule too. And then intensity, looking at speed work compared to jogging. I know we spoke about this for a second. Kind of giving them an idea of how to measure that.
Yeah, so I mean, a big thing that we use here and that I like is the rating of perceived exertion, the RPE scale. So it's simply a 1 to 10 scale. 1 is you chilling, having a doc talk with your boy. 10 would be your boy is chasing you with a BB gun and you're running for dear life because you don't want to get shot.
Bees.
Happens or bees, yeah, the worst, the worst. You want to progress that at 10%, so maybe you're increasing your intensity by 1 scale. So if you're normally running at like a 6 out of 10, maybe this time you're going to go at a 7 out of 10. Now that being said, there's a couple nuances with this too, because if you are increasing intensity, you may have to drop your mileage down a little bit. So you can't just maintain doing X amount of workload and then just spike that up really quick.
Yeah.
It's very useful to drop the mileage down at the same time. And then also too, you can't have every day be a hard day. So if you're like, you know what, I'm feeling good, I'm going to get up to a 9 out of 10, I'm going to run 9 out of 10s every day this week. No, that's not how your body adapts to stimuli. There's a reason why you work out and then you take a break of a day or two before you go work out again in the weight room, and that's so you give your body time to grow and adapt.
Yeah.
You can't water plants all the time and expect them to grow, so you have to give them that break from the water. So there's a concept called the high-low method where you keep your intense days very intense, but then you supplement that with lower days where you're maybe doing a slower run at a longer distance or duration before you do your high day again.
Yeah, and getting your intensity to increase 10%, your mileage to increase 10%, and your elevation to increase 10% all at the same time. Good recipe for major irritations.
Might be 100% increase of going to see one of us.
of pain, absolutely.
At some point.
Just make sure if you have any questions on that stuff, how to measure, what to measure, ask someone that can give you a better idea. If you have questions, let us know. But our next topic is going to be when to actually stop. So if we do have pain, what do we do, Zach? I don't know when I should stop or if I should stop. What do I do?
Yeah, that's a great question.
I'm a
So,
runner, so I'm not going to listen to you.
yeah, exactly. So, well, the way we work here is and we'll show you some activities that a lot of times can be helpful in terms of warming you up. It may help with some of those little dings that you get with running. If you can make it to where you're not hurting, especially with walking, then you might be okay to test the waters running wise. Just do so at an amount that you wouldn't normally do. So if you're used to running 5 miles, maybe cutting down to even 1 or 2 miles, testing, see how you respond. That could be a great way to introduce getting back into running.
Mm-hmm.
But if you you throw everything that you can at it and it still hurts to run, it's going to be counterproductive for you in the long term to continue to do that, because then you could have potentially a more sinister injury.
Yeah.
Shin splints, good example of that.
Yeah.
Why did we say, hey, you might want to chill if you got shin splints? Because that could lead to a stress fracture.
Yeah.
And that will sideline you for a long time. So your body is very good about making sure that you will get your rest at some point. So
shut you down.
if you have to, that doesn't mean that you sit and chill on the couch, but maybe it's finding a cross training activity. Yep. Maybe it's
got to
doing
substitute
some
that
weight
stuff
room.
out.
Yeah, and substituting some stuff out.
Yeah. Yeah. When to stop is, common injuries that can kind of progress. There's stuff in the toes that can start being very angry. There's bunions. There's fractures. There's plantar fasciitis. I'm sure some runners out there, if they're tuning in, can kind of attest to that. That can happen. We can have shin splints. We can have Achilles tendon irritations. We can have knee irritations, patellar tendonitis, jumper's knee. There could be impacts that actually hurt into the hip, into the low back. So these are all really common areas. If they're irritated significantly, it's going to be a time that you need to consider taking breaks from running and seeing how you can modify that stuff. You don't want to let those things stack up on top of each other.
Yeah, and especially if you put off taking time off on the front end, it's probably going to lead to you having to take more time off on the back end.
Long
so
term,
if you can nip it in the bud sooner rather than later, do some of the self-care things that we'll talk about and make some modifications, you'll probably be able to get back to running sooner than you think.
Yeah, cool. So that's our when to stop. We're going to move into a couple of drills that we like to give runners, or that we have given runners, to again have that warm up, have the body kind of primed to use the right areas of the body, how to stride correctly, or at least as efficiently as we can. In general terms, obviously some runners need different things, but these are common ones that we've used in the past.
Mm-hmm.
I don't know if we touched on it, but we do have matching shirts on today, so if you get confused at any time, I have the gray pants, he has the black pants.
Yep, and I got the Kobe's.
And he's got Kobe's on.
So that's always a good way to differentiate us. It's
So
been a while since we made Kyle suffer, so
we gotta do it.
let's go against this wall.
Go this way.
So I showed this move on a therapy talk back in the day, which, have I been here long enough to say back in the day?
I think it's been.
It's been a hot minute, that's for sure. So I'm going to have Kyle lie on his back. He's going to put his feet on the ledge. You can put your feet up against the wall. If you're doing this and you don't got shoes on, I would encourage you to take your shoes or your socks off. And the reason why is because socks are slippery on the wall.
Gotcha.
So you'll get a little bit better grip that way. So the goal with this is you're going to feel back of your legs working, hamstrings, glutes, and abs. Especially, I know you runners, you got your tight hip flexors, and you're doing this wild and crazy hip flexor stretch that's not doing you probably much good. This move can do wonders for that, and it also helps mimic the stride in running. So what I'm going to have my man Kyle here do is he's going to curl his hips up. Imagine that I'm grabbing him by the back pockets on his pants and I'm pulling him up towards his knees. So go ahead and do that, Kyle.
Got it.
A little higher. And then you want to make sure your knees stay in line with your hips and your feet. Keep curling, keep curling. So then what you want to do from that point is you want to take one knee, go ahead and bring it to your chest.
This one?
Yep. And you want to make sure it stays in a straight line, as does this knee. And then you're going to keep curling up. And if you listen quietly, you can hear Kyle's left glute start to sizzle. Next, what Kyle's going to do is he's going to reach to the ceiling as far as he can, keeping your head down. And I want you to breathe in this position. Go ahead and go in through your nose silently. Long, slow, drawn out exhale. Keep reaching. Keep reaching. And you're going to do this move for 3 to 5 rounds per side, 5 breaths. It's a great one before you warm up. Before you go run, I should say.
I'm starting to figure you out, Zach. I'm not sizzling as much, but still feeling exactly what he said.
Perfect.
Posterior chain, getting that hip and glute start working.
I got to pull some more challenging stuff then.
I'm getting
Getting
better.
He is.
Getting better.
Took 15 doc talks, but we got him eventually. So that's a great move that you can use, and I'll link the longer version in the show notes on our website.
Cool. So next, when we're looking at kind of the feet, and this is something that I've seen just recently, so it popped into my head. I've looked at a couple of runners' shoes, and when I've seen the wear patterns, they don't have a lot of push off onto their big toe side. So if their big toe side has a lot of tread left on it, and then the outside didn't, it means that they're kind of pushing off the outside of their foot, and their foot is kind of curling in when they're taking that stride or when they're running. So typically, if there's no other irritations, nothing else going on, I'm going to try to get them to actually push more through the inside portion of their foot when they take that stride or when they're going through the running pattern. So typically I like to get into a wall press position where I'm having them press into the wall, actively push into the wall, and then I'm going to have them drive their big toe down to the ground, raising themselves up so that they don't feel as much on the outside toes as they do on the inside toe. So here, pressing up, squeezing, seeing if I can get the hip to engage, hamstring to engage a little bit, and all while keeping what Zach has said in the past, a stacked kind of position, so we're not getting into this type of running motion. So stack, keep that tailbone tucked under us a little bit, and press through that big toe.
Yeah. And that's actually a nice progression from the move on the ground too, because it's essentially the same thing as standing.
Absolutely.
And if you really wanted, because I've done a move similar, if you really wanted to kick it up a notch, you could also go to one hand, so then you really are mimicking a stride stance.
Single leg stance, yeah. Absolutely. So those two, we will get you guys some videos for those if you want to incorporate that into your warm-ups. And then looking at form and cadence, this is more conceptual for the cadence portion. When I've told runners to figure out a little bit less stress, if we want to have less stress on certain areas, then we're going to figure out ways to increase our cadence, our turnover of our feet, and not increase our stride. So if our stride ends up going a little bit longer, then we end up having a jump, step, and it increases the ground reaction forces that are accepted by the body. So if we keep that short, then it's just little steps, and it's a lot less ground reaction forces that the body has to accept. So cadence, if we can start bumping that up just a little bit and seeing how your body accepts that, that's a good way to do it. You can think beats per minute. There's a couple of apps out there that if you look for running apps that have cadence, it's like a metronome type thing, but it actually has music to it. It can be really helpful for figuring out what your cadence will be for helping.
Yeah, and we'll link some of our favorites to those in the blog.
Absolutely.
If you're having a hard time figuring out how to get that cadence to go up, the easiest way to increase your stride frequency is by pumping your arms a little bit faster.
Yeah.
The connection from your arms to your brain is much faster just because it's closer as opposed to the legs. So a lot of times pumping the arms a bit faster can be helpful. Another cue that we really like to really smooth out striding is to actually reach just a little bit more forward than you normally are. A lot of times when people are running, they'll keep it like really close and tight here, and they'll be arched. Yeah. And essentially that's your body's braking mechanism preventing you from falling forward. Because if you think about it with running, essentially what it is it's a controlled fall. Yep. So if you are like, I don't want to fall, I might arch my back and pull my arms backwards more to reduce that we want to keep that forward momentum going. So a lot of times just thinking, just slightly reach the arms a little bit more forward as you run can make your running more efficient, much smoother, and more comfortable.
And just to add on to that, the arm swing, if you're one of those people that kind of does something like this or is very asymmetrical, it can really help with your lower body if you get your arms to start swinging a little bit more symmetrical, because it'll get the opposite side hip to do certain things that it might not have been doing if you have one that's kind of chicken winging or doing something funky.
Yeah. And if you've tried that and you're still running into some issues in terms of being able to get that, you could have some limitations in your upper body or even in your lower body that are making you go that way.
Yeah.
Now, if only we had some docs available who could help with that, man. Oh my gosh. How did this get here? Give us a call, because we can definitely help you out with that. And I've had some pretty cool things where we didn't mess with anything running, done some activities to people,
Yeah.
and their form changes.
It
I mean,
does.
we have that a lot with our golfers as well. We most certainly have had that with our runners.
Yeah.
So give us a call.
Let us know if you guys have any questions.
Which
Did
we
we have
may
any
on
questions?
IG, actually. Let's see what we got here. Oh, man. Mike, if you're still tuning in, you're a boss. Most deaf in the house. That's one of my guys. Dr. Booth is a beast.
Hayden, what's up, man?
Yes.
Congrats on signing. All right, guys. If you have any questions, shoot it into the post, comments.
Comments, or give us a call at 702-558-2151. We would be happy to help sort things out.
See you guys next week.
Adios.